A single data breach involving protected health information costs a healthcare organization an average of $10 million. That number does not include the reputational damage, the regulatory investigations, or the loss of patient trust that follows. And yet, every day, healthcare organizations hand sensitive patient audio recordings to transcription vendors without asking a single question about HIPAA compliance. That gap between risk and awareness is exactly why HIPAA-compliant medical transcription services exist, and why choosing the wrong vendor can become one of the most expensive mistakes a healthcare organization ever makes. Let's talk about what HIPAA actually requires from transcription vendors. Under the Health Insurance Portability and Accountability Act, any vendor who receives, stores, transmits, or processes protected health information, what the regulation calls PHI, is classified as a business associate. That classification triggers a legal obligation. The vendor must sign a business associate agreement, or BAA, with your organization. They must implement administrative, physical, and technical safeguards to protect PHI. Their staff must be trained on HIPAA privacy and security rules. And critically, they must be able to demonstrate compliance, not just claim it. A transcription company that processes patient recordings without these safeguards in place is not just a liability, it is a compliance violation waiting to happen with your organization's name attached to it. So, who carries this risk most directly? Healthcare administrators managing vendor contracts, clinical documentation specialists who work with physician dictations, operative reports, and discharge summaries every single day, hospital compliance officers responsible for audit readiness and regulatory exposure, and private practice physicians who dictate patient notes into a voice recorder, email the file to a transcription service, and assume everything is fine on the other end. These are the professionals who need to ask harder questions before a single audio file leaves their organization. Now consider the situations where this becomes urgent. A hospital system onboards a new transcription vendor for radiology reports without confirming whether a BAA is in place. A behavioral health clinic sends therapy session summaries to a general transcription service that uses offshore contractors with no HIPAA training. A group practice grows quickly, and its physicians start using consumer-grade transcription apps that store audio in unencrypted cloud environments. Or a compliance officer conducts an internal audit and discovers that the transcription vendor their organization has used for 2 years has never signed a business associate agreement. Each of these scenarios is a real compliance failure. Each one creates exposure under the HIPAA privacy rule, the security rule, and potentially the breach notification rule. The trigger is always the same: outsourcing transcription without vetting the vendor's security posture first. This is where Ditto Transcripts operates differently. Ditto Transcripts is a US-based, full-service transcription company that is fully HIPAA compliant. That means Ditto Transcripts can serve as a proper business associate, execute a business associate agreement, and handle protected health information under the safeguards the regulation requires. But what makes Ditto Transcripts credible in this space is not just a compliance checkbox. It is the operational infrastructure behind it. Every staff member at Ditto Transcripts passes a fingerprint-based criminal background check. Not a name search background check, a fingerprint check. The same standard used in law enforcement contexts. Ditto Transcripts is also CJIS compliant, meaning it already meets the Criminal Justice Information Services security standards required for sensitive government and law enforcement data. That security architecture does not get scaled back when the content is medical. It carries directly into how Ditto Transcripts handles patient recordings, physician dictations, and clinical documentation. Ditto Transcripts provides medical transcription across specialties. Operative reports, discharge summaries, consultation letters, radiology dictations, psychiatric evaluations, and more. The same rigorous handling that applies to a sensitive law enforcement interview applies to a recorded patient encounter. There is no second tier of security for healthcare clients. The standard is the standard. And because Ditto Transcripts is US-based, your PHI never travels to offshore contractors operating outside US regulatory jurisdiction. What does that mean in practice for a compliance officer or a clinical documentation director? It means you can outsource transcription without creating a new compliance gap. You can request and receive a signed BAA before your first file is processed. You can answer an auditor's questions about your transcription vendor with confidence. Your physicians can dictate freely, knowing the service receiving that audio has already passed the same scrutiny required for law enforcement data. For a private practice physician, it means your patient notes get transcribed accurately by US-based professionals who understand what protected health information means and why it has to be handled carefully. The risk of getting this wrong is real, documented, and expensive. The process for getting it right starts with one decision: choosing a transcription partner whose compliance and infrastructure was built before you asked for it. That partner is Ditto Transcripts. Learn more and start a conversation at uDittoTranscripts.com.